Hello, my people. My name is Evelyn. I go by the name Nas Mamli O on YouTube, Instagram, and Facebook. I am a nurse by profession. I was born in Kenya. My father was an education officer and my mom was a clinical officer. If you live in Kenya, you know what that means because outside here, they don't know, nobody understands what clinical medicine is because they don't have it. Otherwise, I went to school as a normal child. We lived a humble life with my parents, and I am the firstborn. So I had to lead the group. The direction I took really mattered. If I played in school, they would play. When I finished my high school, I had an option of joining either school of nursing or education. But because my father was an education officer, I understood what it all entailed. And my mom, having worked in the hospital, I also knew what it all entailed. So there was confusion between should I be a teacher or should I train as a nurse? But because from childhood, I used to see my mom, she was a nurse before she changed into clinical medicine. So I used to see her going to work. I can remember vividly when I was very young, I think maybe below 10 years old, how she used to leave us and go on night shift. I would peep through the window to see how she's walking to work and in the morning when she's coming back. And I loved the uniform. And we lived within a hospital premise. So it was easy to see nurses and see the hospital as we passed through. We had to pass through the hospital somehow as we went out of our home. So I admired my mom, and I used to say those days that one day I will also be a nurse. So in my mind, the nursing was always there because I knew you had to care for patients if you're a nurse and give your all. And I thought, oh my God, God will give me more blessings if I looked after the sick, people who are very needy. So it wasn't so hard to decide whether to become a teacher or to become a nurse. I then went to Nairobi. We lived in Kisumu. I went to Nairobi to live with one of my very favorite uncles who invited me to his place. I'm sorry to mention, but he is Professor Magoha. He took me as his child from the time I finished my high school. And basically, he took my care over from my parents. And he's the one who guided me and actually advised me to join nursing because he was already working. You remember, he's a doctor, he was already working as a surgeon. So he helped me make the decision of joining nursing, him and his wife. And I owe it to them to date. So I joined KMTC Nairobi, which is my route, which means I trained at the Kenyatta National Hospital. Anybody who works at Kenyatta National Hospital, are you out there? Anybody who trained at KMTC Nairobi, your big sister is here. You know what it entails to work or even train at the Kenyatta National Hospital and the KMTC Nairobi. So during my training, it was just a normal training like for every other student. And I managed to qualify. When I finished my training as a nurse from the Kenyatta National Hospital, I really did not know where to go and work. But all I knew is that I wasn't ready to go outside to the other provinces to work because I'd gotten so used to Kenyatta National Hospital. And this is a major referral hospital. And I was wondering how I was going to fit into the district hospitals in Kenya. Because you never knew where you were going to be posted. You were never going to choose where you were going to be posted. And I was worried some areas I wasn't really feeling like high risk areas. So then I decided that probably I'm better off working at the Kenyatta National Hospital where I trained. So I applied for the job. And most of us in my class applied for the job. More than half the class applied for the job at the Kenyatta National Hospital. We were invited for interviews, and most of us came through. And we were now posted to different wards and different departments. My worry then was I did not really, and I prayed not to be posted to orthopedic wards because during my training, I never really loved orthopedic. And today I can say it's because of the bedpan rounds that really terrified me. That at a time, there was a time it was bedpan rounds and you move around with the bedpans. So that really terrified me because I was still young and I don't know how I was looking at it. But today I would not really mind working there. So I prayed and somehow I landed on pediatric surgical ward. And this is a ward that during my training, somehow I did not have a rotation, but I had pediatric general wards, pediatric medical. I had a rotation on those wards. I came to love this ward. The team that I met on pediatric surgery, they know themselves. And one of them is, I'm not going to mention you, I'll mention you by name, but I'll not mention your first name. So, Auma, you know yourself. The team was fantastic. The matron for the ward was so good, very understanding. The good thing is that they all understood that I was new, and I was new to pediatric surgery. I never had a rotation. I was still very young and ready to learn. And I took that opportunity and learned a lot, a lot, a lot. And by the time I was leaving that ward, I was like an expert. I just need to mention that I landed on that ward despite requesting to go to their main theaters. And I was not posted to theaters, which was a disappointment. But when I went to pediatric surgical ward, oh wow, what a nice ward that was. The consultants there were also ready to teach. So up to date, the things I learned on that pediatric surgical ward, I have never forgotten. And then because in my heart, the place I loved the most was operating theaters. And during employment, I wasn't taken to the theaters. So I said, okay, how do I go about this? Then I decided, okay, then I'm going to have those training for theater nurses. They had a diploma for theater nurses, and I decided to join that team. And I joined that class. Then I was trained as a theater nurse, just in order for me to find a way of moving into the operating theaters. And that is how I left my very good pediatric surgical ward and went to work in theaters, a place of my choice, a place that I enjoy working in to date. I think I was just meant to work in theaters because when I look around, there is nothing else I would go for other than working in theaters. So I joined the main theater. It's a place I had done quite a long rotation during my placements. So I knew like everybody there. But you know, theaters is different. You have to learn. And it's not something that you just go read in the book. It's practical. So I joined a team, a fantastic team that taught me how to go about every case in operating room. And I think they had done that when I was a student. So that's why I loved it. It was something I knew I wanted to do from the way people did things. It is such a different environment compared to other specialties in nursing. So I became a nurse. I became a theater nurse. I learned a lot, but I knew I had to read my anatomy. I had to read my anatomy and physiology to really understand the procedures. Because unless you understand the anatomy as a scrub nurse, you will not know what goes next. But for you to understand the sequence of the surgery, what layer after what, and what instrument is meant for which part of the body, you need to know your anatomy. So I did so well. I learned a lot. I was very committed to my work. I enjoyed it. I really, really enjoyed working in theaters. So somehow I moved a step higher. I became in charge of a theater. And it was normal. It's not like it was a difficult thing. So during my work in Kenyatta, people started moving to the UK. I then also moved to the UK early 2000. And when I came to the UK that time, most nurses used to start from nursing homes. You come through a university, and I came through TVU, Thames Valley University. And I was allocated to a nursing home in Boramwood. A nursing home that was so nice. The care of the elderly was very nice. And to Kenyans, when I talk about nursing home, it's different from the nursing homes in Kenya. The nursing homes in Kenya are like small hospitals for any patient who would be seeking treatment. But in the UK, the nursing home is for the elderly and anybody with learning disabilities who really need a lot of care. So I was taken to this nursing home. That's where I did my training until I got my registration. When I got registered and got my PIN, here in the UK, they call it the PIN. So when I got my PIN after 3 months, I think after 6 months of training, then now you're free to look for a job in a hospital if you want, or you can continue working in a nursing home, or the same nursing home can still employ you. But I chose to go back to what I love most, theatre nursing. So I applied several places, and because I'm new to the country, sometimes you'd be given regrets just because you're still new to the country and they want somebody who is already in the system that understands the UK system for theatre nurses. So one day I applied for a job and I was called to this job in central London. I did the interview and I passed. That trust is where I work to date. I have been in this country about 20 years and I've worked for that trust about 17 years. They interviewed me, they loved what I told them, and I have worked passionately for this trust. And I can say it with my head high because I know if they watch this video, my colleagues, if they watch this video, they will say, yes, she does the job. So at the moment, at that time, I started with adult theaters. And then I moved from that hospital. In this trust, there are so many different branches of hospitals. So the one I started with, I moved from there. Then now I moved to maternity, where we do cesarean sections. But then there was a merger between maternity and pediatrics in the hospital where I work. So at the moment, I work for pediatric surgery and maternity. It's a children's and women department. But because I don't want to lose my adult skills, I still go to our adult theaters to work there so that I maintain my skills. And I can assure you, I have learned a lot. I have enjoyed working as a theatre nurse. I don't think I would change it for anything. Although it is very tiring, sometimes you go without going to the toilet. You can start a case in the morning and finish in the evening. It needs dedication, commitment, and above all, you must love your job and understand that these patients come to you because they have hope that you're going to help them. They are very hopeful that the care you are going to give them is going to save them from all the pain that they have. So as a theatre nurse, I always advise the young nurses, the newly qualified, even just the new nurses who come to the department, that unless you're committed and unless you know your anatomy, then you're not going to give the services as required, and you're not going to meet the objectives of the department of ensuring that patients get individualized care. So as a team leader now, a lot of responsibilities come with it. You have to ensure that you have everything, and you must understand each procedure as it treated a day before, so that you're able to prepare for what is required. Otherwise, the patients get cancelled. So as of today, I am still a proud theatre nurse, but I owe everything to my roots, the Kenyatta National Hospital, the KMTC Nairobi. Everywhere I walk, I mention this hospital. I follow you on Facebook too, Kenyatta Hospital, and I love the things you do. I know it's not very easy, but I'd say continue doing what you do. You're doing your best. For those who have not subscribed, please do subscribe to this channel for more nursing experience, medical, and everything else that comes with being a nurse, so you don't miss out. With that, I say thank you for watching, and come again next time. Where did you train if you're a nurse? Please share your experience on the comment section below. Thank you for watching, and goodbye.